A very good afternoon to all distinguished guests, honorable faculty member, dear student, and esteemed colleagues. On behalf of Department of Obstetrics and Gynaecology, I extend a very warm and hearty welcome to all gathered here to celebrate 92nd Foundation Day of our department. Foundation Day is an occasion to celebrate, acknowledge the invaluable contribution of stalwarts and pioneers who laid foundation of the department at different stages of development, and a day to pledge to carry forward the legacy left and envision future with hope and fidelity. We are honored to have our chief guest today, Honorable Vice Chancellor, King George's Medical University, Professor Sonia Nityanand Ma'am, with us. Ma'am's hard work, dedication, commitment are unparalleled. Ma'am was instrumental in establishing the bone marrow transplant Ma'am was instrumental in establishing the bone marrow transplant program in SGPGI, the first bone marrow transplant program of the state, and then third successive program in the country. Ma'am established the Department of Hematology and World-Class Stem Cell Research Center in SGPGI. Ma'am is a core committee member for drafting national guidelines on thalassemia, hemophilia, and venous thromboembolism. Ma'am is avid researcher. Ma'am has done pioneering work on aplastic anemia, fetal stem cell infections. Ma'am's vision, vast experience, leadership, and indomitable spirit for excellence motivates us to keep doing good work. Ma'am, we are delighted to have your gracious presence. Welcome, ma'am. Next, with deep gratitude, I invite our guest of honor, Dr. Kalyani Das, ma'am, former head of the Department of Obstetrics and Gynaecology, to grace the dais. Ma'am's exemplary contribution to growth of our department is source of inspiration to countless individuals who are striving to make difference in the world. Ma'am, we are honored by your gracious presence. Next, with deep regards, we are privileged to have a well-known magnanimous personality with astounding accomplishment, renowned expert in field of infertility, President-elect Indian Fertility Society, Professor and Head of the Department of Obstetrics and Gynaecology at AIIMS, New Delhi. Our guest speaker for today, Dr. Neena Malhotra, ma'am. Ma'am is an alumni of King George's Medical University. We are incredibly fortunate to have you here today. Welcome, ma'am. Next, we are honored to have Dean of our university, Professor Amita Jain, ma'am, with us. Ma'am is a profound, accomplished, and prolific personality and has established reference lab for tuberculosis in the state of Uttar Pradesh and state level virology lab, providing laboratory services of viral outbreak in states of Uttar Pradesh and neighboring states. Ma'am has numerous accolades to her credit. Welcome, ma'am. Next, with deep regards, we are privileged to have our ever-smiling head of the department, Professor Anju Agarwal, ma'am. Ma'am is always at the helm of affairs. Ma'am's leadership, expertise, and mentorship continues to inspire excellence in all we do. Ma'am has been a source of encouragement and support to us in all our endeavors. Welcome, ma'am. On behalf of department, I would request to welcome the esteemed dignitaries on the dais with a planter as a token of our respect and gratitude. I also request Dr. Smriti Agarwal and Dr. Mona to welcome our esteemed guest and respected senior faculty members of our department with Ekal Pushp as a token of our love and affection and gratitude. I would like to welcome Dr. Manju Shukla ma'am with Ekal Pushp, Dr. Uma Singh ma'am with Ekal Pushp as token of our love and respect. Dr. S.P. Jaiswal ma'am, Dr. H.P. Gupta ma'am, Dr. Indu Tandon ma'am, Dr. Yashodhara Pradeep ma'am, Dr. Seema Tandon ma'am, Dr. Vrinda ma'am, and I would also like to welcome with Ekal Push our Dean Student Welfare, Kushwaha sir, Dean Nursing, Punita ma'am, our Controller of Examination, Anup Verma sir, and our Dean Quality Planning, Dr. R.K. Garg sir. Lamp lighting is considered an auspicious ritual that marks beginning of an important event. Lighting a lamp is believed to invoke divine blessing and ensures a successful and prosperous outcome. Lighting lamp is seen as a beacon of hope. I request dignitaries on dais to kindly step forward to kindle the lamp. Goddess Saraswati is considered the embodiment of wisdom and patron deity of learning and intellectual pursuit. I invite residents of our department to invoke blessings of Ma Saraswati with Saraswati Vandana.
हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ। हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ। तू स्वर की देवी है, संगीत तुझसे, हर शब्द तेरा, हर गीत तुझसे। तू स्वर की देवी है, संगीत तुझसे, हर शब्द तेरा, हर गीत तुझसे। हम हैं अकेले, हम हैं अधूरे, तेरी शरण में हमें प्यार दे माँ। हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ। मुनियों ने समझी है, गुनियों ने जानी, वेदों की भाषा, पुराणों की वाणी। मुनियों ने समझी है, गुनियों ने जानी, वेदों की भाषा, पुराणों की वाणी। हम भी तो समझे, हम भी तो जाने, अविद्या का हमको अधिकार दे माँ। हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ। तू श्वेत वर्णी कमल पर विराजे, हाथों में वीणा मुकुट सर पे साजे। तू श्वेत वर्णी कमल पर विराजे, हाथों में वीणा मुकुट सर पे साजे। मन से हमारे मिटा के अंधेरे, हमको उजालों का संसार दे माँ। हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ।
Next, I courteously invite our dynamic head of the department to give welcome address and to present departmental report.
Respected VC ma'am, Dean ma'am, a very special guest of honor, my teacher, my guide, Dr. Kalyani Das, who has helped me at every step of my life. A very special guest and a dear friend, Dr. Neena, who's HOD AIMS and who has joined us today to deliver the Dr. Prabha Mehra oration. All my teachers, Dr. Indu Tandon, Dr. H.P. Gupta, Dr. Manju Shukla, Dr. Uma Singh, Dr. Yashodhra, Dr. Jaiswar, Urmila ji, Dr. Seema Tandon, Dr. Brinda, and all the dignitaries, Dean Paramedical, Dean Nursing, Dean QP, and Dean Student Welfare, and COE, and CMS. And I apologize if I missed out anyone, all my seniors, my teachers, and my dear friends. Thank you so much for joining us today. I feel truly privileged to stand here and welcome you all to this 92nd Foundation Day of our department. And I would also like to take this opportunity to walk you through the developments in the department in the last year. So the vision of our department is to provide comprehensive patient care by working as a team and offering high standards of medical services, teaching and research work in an ethical manner. We celebrated our last Foundation Day on the 2nd of December 2023, where we had an oration by Dr. J.B. Sharma, again from AIMS, New Delhi. And the department is blessed to have a very dedicated and motivated OBG faculty of 19 members at present, with support from Dr. Radheshyam, who's our ICU expert, Dr. Dipali, who's our medical officer in charge of the family planning. There have been some changes in the faculty structure in the last year. Dr. Shilpa, our associate professor, she went on leave without pay to join a position in Australia. Dr. Jaiswar superannuated on the 4th of May when I took over as the head of the department. Dr. Smriti, who had been on Lien for 2 years, returned on the 9th of May 2024. Dr. Nisha was appointed as a professor in the Gynaecology department. And the department had 2 new members in the QMH family, 2 new assistant professors, Dr. Vandana and Dr. Namrata Yadav. So when we look at the awards and achievements of the faculty, I was installed as the Vice President of ISOPAB at Raipur and nominated as Chairperson of the OBGYN Committee by NMC for curriculum revision, and also received an award of excellence by APGL by my dear friend Sunita, who's here with us, and I'm very happy to have her with us. Dr. Nisha received an appreciation award by VC ma'am on Ovarian Cancer Day, and she was installed as the Vice President of AOGEN. Dr. Rekha had her patent sanctioned on the detection of cervical cancer. She also received an award for outstanding service as obstetrician at the midterm UPCOG at Muzaffarnagar. Dr. Sujata received an appreciation award for public health awareness by the Honorable Governor of Uttar Pradesh, and she started the Alambain Associates Charitable Trust, an initiative to promote awareness about organ donation and women's health. Dr. Amita Pandey received the CS Dawn Best Paper Award for Pelvic Medicine at the National OBG Conference. She completed her advanced course in medical education and received an award for the best poster at that. She received an Utkrish Seva Award by IMA and an award at the W3 NatCon. Dr. Seema received the Dr. C.S. Dawn Award for paper presentation, again at the National OBG Conference. She received an appreciation award for Safe Motherhood Committee work, and she received the Health Icon Award. Dr. Pushpa received the Pragati Samman Award for social activities. Dr. Smriti received the Healthcare Excellence Award. Dr. Mona was bestowed with the Fellowship of the Indian College of Obstetricians and Gynecologists. She also received a Fellowship of Chronomedicine, and she received the Academic Excellence Award at Muzaffarnagar, and she completed the Advanced Clinical Skill Development course in ART. Dr. Manju received the first prize for oral presentation at 2 conferences, one at the North Zone Yuva Foxy and second at the NIGF National Conference. And she was also bestowed with the Pragati Samman Award. Dr. Vandana received an award for being an international outstanding researcher. Dr. Monica got a first prize in paper presentation at the UPCOG, and she too completed the Advanced Clinical Skill Development course in ART. Dr. Namrata was awarded as the Young Achiever in Fetal Medicine. Our residents too are not far behind. They are working tirelessly, presenting their work at different conferences, getting prizes. First prize for paper presentation was received by 2 GR3s at 2 different conferences. A GR2 also got a first prize for paper presentation. Another GR2 got a second prize, and a GR3 got a consolation prize. They have also been winning laurels at quizzes where they have stood at second position and consolation prizes. So these are some of their pictures. There are some new services being started in the department. We have initiated the fetal medicine OT, and procedures including intrauterine blood transfusion are being done. We have installed a pad vending machine in the department, and we have installed the laser machine, which is now being used for different surgeries. We are very happy that our strength has been increased by 78 new nursing officers who joined the department in June 2024. And with the help from our nursing staff, we are better able to manage much of the data provision, because Obs and Gynae department has to provide a lot of data to the government. Mantra app, UVN app, RCH portal, JSY, CRS, JSSK, HMIS. So our nurses are working diligently and constantly to help us complete the issue. The department has also been busy with publications and research. There have been 42 publications in the last year. There are 23 ongoing projects with a total budget of about 70 lakhs. When we look at the innovations in teaching, we are, of course, conducting the NMC prescribed UG and PG teaching. Besides that, we are conducting the Gynae Obs Learning Forum, or GOLF. Previously, we were limiting it to the state of Uttar Pradesh. Now we are covering the whole of India. We are getting credit points for the training, and we give certificates to the participants, both the faculty and residents. Another training which the department has started is the taller training for optimization of labor room practices, where we are giving focused training to the team which is going to be posted in the labor room. And we are also involving the nursing staff in the same. There are certain special workshops which we have organized for the postgraduates of not only our department, but also other medical colleges of Lucknow, including the MRI interpretation workshop, abnormal uterine bleeding workshop, and a PICSEV workshop on research methodology. And today morning, we had a very successful IUI workshop, which was very well attended by all the residents and faculty. The department is also continuously conducting trainings for doctors working in the periphery. Besides the CMONC and PCP and DT, which we are conducting from before, Two new trainings have been initiated in this year. One is the surgeon's training for cesarean section, and the other is the obstetrician training in obs ultrasound. And we are very proud to inform that KGMU has received the FICCI Award for Excellence in Training and Skill Development Initiative, which is all a result of the dedication and commitment of faculty of OBG, Pediatrics, Community Medicine, Anesthesia, and of course the IHAT and UPTSU team led by Dr. Seema Tandon, and the support of our Honorable VC Ma'am. When we look at the departmental data, we had more than 1 lakh OPD attendance in the last year, about 8,000 deliveries. The cesarean rate was quite high, about 60 to 65%. And we hope our taller training will help us in reducing cesarean and episiotomy rates in our department. Total operations were 17,000 in the last year. We also organized some cultural programs because our residents and faculty are very talented. So we had cultural programs on Holi, Doctor's Day, Teacher's Day, and Diwali in the last year. Different public awareness and social programs are organized by the department. On the different days, like the Menstrual Hygiene Day, we conducted a HPV vaccination drive. We conducted a program on the World Contraception Day. We also conducted an outreach program on HPV vaccine awareness. Then a program on World Ovarian Cancer Day, where the patients of ovarian cancer were felicitated. World IVF Day, World Breastfeeding Week, World Menopause Day, where we invited faculty from orthopedics and psychiatry also to counsel our women. And different outreach activities have also been conducted. We also regularly conduct awareness programs on the social media, like Doordarshan, radio, YouTube channels. And we also celebrate some national days, like the World Yoga Day, when we conducted a yoga camp for antenatal women with the help of our Dean Student Welfare. We held a slogan competition for residents and conducted a plantation drive on the World Environment Day on 5th June. And we conducted a waste to art competition for our UGs as part of the Swachhta Pakwada. And we are really amazed at the innovation and the type of items they made. And we have displayed them in our department permanently. We conducted a Nukkad Natak and awareness program on Road Safety Week. There have been some guest lectures in the last week. Dr. Anju from UK came for a PG class in December last year. And at the alumni meet, we had our Dr. Neena and Dr. Preeti Khillan from Australia and Dr. Chinmay from Hyderabad. Also, we had Dr. Anupma Bahadur from AIMS Rishikesh for PG teaching in the month of May this year. So in the coming year, we hope we'll continue to work harder. We pledge to continue to work harder. We hope to start electives for our PGs. We hope to establish a labor room for positive birthing experience with the provision of alternative birthing positions, good labor analgesia, and music therapy. We plan to develop teaching modules and videos to initiate yoga and antenatal exercises for pregnant women, to initiate some new value-added courses, and we hope we can get a modular elective OT and a CSST. So thank you very much. And I again pledge that we'll plan to push boundaries even further in the years ahead. Thank you very much.
Thank you, ma'am. Next, I invite Dr. Manjulata Verma and Dr. Namrata Yadav, who worked unwearied to prepare the departmental newsletter to lend helping hand to dignitaries on dais for release of the departmental newsletter.
I'll carry on from here. Co-hosting this is a very tall order for me, somebody as junior as me. Please forgive me if I fumble. I'm seeing people whose anecdotes I've heard since my residency. So I may get a little nervous. Please bear with me. So we start with the felicitation. So the year round, we all know what gynae is. It's complete chaos. And in the rigmarole of daily activities, we may forget to appreciate those who actually support us and are part of our team. Gynae is nothing without teamwork. In fact, gynae में जितना teamwork होता है उतना शायद कहीं और नहीं होता है. तो आज हमारा दिन है कि हम उन लोगों को appreciate करें जिन्हें शायद साल भर हम लोग सूतते हैं या नहीं appreciate कर पाते हैं. We are sorry. So we start with now the most humane resident. This is a very special award और gynae में तो और भी ज़्यादा relevant है जहाँ पे कि सब लोग बोलते हैं gynae is supposed to be one of the most toxic residencies all over the world. So in this mayhem and the chaos, somebody who's able to retain her character is really commendable. And somebody long before me thought about this, and that was Dr. P.L. Mahajan. I have never met her, but I've heard a lot about her. और इस सोच से ही पता लग जाता है वो कैसी होंगी. उन्होंने ये idea float किया था that somebody not for competency or not for intelligence or not for knowledge. बहुत सारे awards हैं उन सब चीजों के लिए. लेकिन कोई ऐसी चीज जो कि हम सब एक डॉक्टर में ढूंढते हैं as a patient, as a junior, as a senior, लेकिन हमें नहीं मिलती हर टाइम उस चीज को अवार्ड करने के लिए शी चोज टू फ्लोट दिस मोस्ट ह्यूमन रेजिडेंट अवार्ड. मोनिका, विल यू कम फॉरवर्ड? आई थिंक यू शुड बी रियली प्राउड ऑफ दिस. मोनिका सिंह, RJR2, एंड द इंपॉर्टेंस ऑफ दिस अवार्ड इज कि इट इज इलेक्टेड बाय द सीक्रेट बैलेट सिस्टम और उसमें सिर्फ इसके कलीग्स नहीं बल्कि इसके सीनियर्स, हर चीफ रेजिडेंट्स, द फैकल्टी एंड द नर्सिंग स्टाफ, हम सब वोट करते हैं और सीक्रेट बैलेट से अनोनिमसली वोट करते हैं. सो शी इज रियली वन इट एंड डिजर्व्स इट. सो आई एम वेरी श्योर कि इस तरह की अगर सीड्स होंगे wherever she'll go after this college, ये she'll be the seed to sow and she'll create a less toxic gynae department wherever she goes. Congratulations, Monica. Now, for a department which is grappling with French leaves of residents, we thought of an innovative idea to try and encourage those who chose to come back to the department and maintain decorum while the others took leave. They also doubled up for the duties of the absentees. So, congratulating and appreciating Dr. Shalini Yadav for her maximum attendance, JR3. Believe me, it's very good to know that the residents will turn up. Aarti Verma, JR2, thank you for maintaining an attendance, a respectable attendance, when the others choose to kind of abscond. Shambhavi Jha, JR1, maximum presence in her batch. So whenever somebody is absent, somebody else is doing her work, and these are the girls. मेडिकल एंड पैरामेडिकल स्टाफ हमेशा साथ में काम करते हैं और ये सोचना कि पेशेंट को हम ठीक करते हैं गलत है. एक टीम वर्क है और इस टीम वर्क को हम ऐसा नहीं कि रियलाइज नहीं करते लेकिन शायद जता नहीं पाते हैं. तो हमारी सिस्टर्स के कंट्रीब्यूशन क्या वो वेरी मच पार्ट ऑफ द टीम है, 50-50 हैं. तो उनके कंट्रीब्यूशन को अप्रिशिएट करने के लिए वी आर कांग्रेचुलेटिंग सिस्टर प्रियंका शर्मा, प्लीज. ये ओपीडी इंचार्ज हैं एंड व्हेन एवरीथिंग इज गोइंग मैड एंड देयर इज होल मेहम, and that is the time when tempers are flying high and she's calm. पेशेंट केयर के लिए बहुत जरूरी है लॉजिस्टिक्स और एडमिनिस्ट्रेशन. लॉजिस्टिक्स मतलब दवाइयां, प्रोक्योरमेंट्स, एवरीथिंग, एंड इट इज अ होल डील ऑफ पेपर वर्क विच वी डोंट इवन वांट टू गेट इनटू. अविलेश जी, अगर आप नहीं होंगे तो वाकई हम कुछ भी नहीं कर पाएंगे, हम सिर्फ प्रिस्क्राइब करके रह जाएंगे. Mr. Avilesh Kumar, our pharmacist. Now with everything coming online, एक जरा सा PowerPoint नहीं चलता है तो palpitation होने लगता है कि क्या होगा. There is somebody who's handling all the paperwork from Janni to everything. Raghvendra Upadhyay, please. Thank you for managing it so well. And believe me, the government takes it out from us. इतना paperwork है और इतना online है, and they manage it really well. जितना काम गायनी डिपार्टमेंट में ओपीडीज में और ओटीज में होता रहता है, एक पैरेलल वर्ल्ड चलता है हमारे एडमिनिस्ट्रेटिव ब्लॉक में. और मिसेस पुष्पा हर कमरे के बाहर पेशेंटली कागज लेकर वेट करती रहती हैं, नेवर गेटिंग एंग्री, एंड देयर इज ऑलवेज अ कॉपी ऑन आवर डेस्क. कुछ भी होगा पुष्पा जी कॉपी रख दी एंड द कॉपी इज देयर ऑन आवर डेस्क. थैंक यू सो मच फॉर बेयरिंग विद अस. ओटी कंप्लीट केओस, गायनी ओटी, एड्रेनलिन हाई, सबका, पेशेंट का भी और हमारा भी, और सबके ऑर्डर्स होने और सबसे पहले फॉलो होने हैं. मनोज जी, मिस्टर मनोज कनौजिया, थैंक यू वेरी मच हमारे टैंट्रम्स को, हमारे टेम्पर्स को झेलने के लिए. एक जगह है हमारे डिपार्टमेंट की जो हमेशा इंस्पेक्शन रेडी है, वो है फैमिली प्लानिंग ओटी. मिसेज मंजू, आई एम सॉरी, मैं रेजिडेंट रही हूं तो मैं हमेशा मंजू बुआ ही बोलूंगी. थैंक यू सो मच फॉर मेंटेनिंग द पीपीओटी सिंगल हैंडेडली.
I request dignitaries to kindly take the seat on the dais. Next, I humbly request our Honorable Vice Chancellor Ma'am to encourage and bless her with her words.
Thank you. Dr. Kalyani Das, who's been my very respected teacher. Dr. Amita Jain, the Dean Academics of KGMU. The orator today, Dr. Neena Malhotra, very much Georgian and alumni from this university. 1984 batch, so 4 years junior to me, you know. The head of the department, Dr. Anju Agarwal. All the esteemed teachers from the Department of Gynaecology and Obstetrics who have retired. All the other esteemed faculty members of the department. I can see people have come from SGPGI also, you know, and all the other faculty members from the university, and all the staff, students of the department. A very warm welcome to this 92nd Foundation Day of the Obstetrics and Gynaecology Department. So it's got 92 years of glorious history, some of which I have seen because I am also a graduate from this college, now of course the university. So it's really got 92 very glorious years with very, very eminent teachers. Some of them are sitting here also. I've actually seen the department from Dr. Kuti's time and then Dr. Prabha Mehra. So I'm so honored that there is an oration today and I am a part of this inaugural session in her name. I would like to begin by congratulating Dr. Anju for adding on one more glorious year, and of course, many more to come. Your presentation of the departmental report is very impressive and very encouraging. And many congratulations to you for obtaining the very prestigious FICCI Excellence in Healthcare Award for Skill Development. It shows the years of efforts, in the training and skill development which has been imparted in collaboration. And I'm very happy that Dr. Seema Tandon is also here from IHAT and TSU, and Dr. Uma Singh, that both of you are here, because it would not have happened without your being in the team and actually initiating the program. So I'm very happy to see both of you, and thank you for coming. I hope, Dr. Anju, that in the years to come, you'll get more FICCI Excellence Awards, Healthcare Excellence Awards, and many more awards. I also would like to congratulate the department because they gave a very nice, which Dr. Anju did not highlight, but a very good presentation, a CGR, a combined clinical grand round on one of the Saturdays on postpartum hemorrhage. I think Dr. Smriti had conducted it, It was a very informative and good CGR that was presented by the department. We have a very meaningful oration today by Dr. Neena, who's the head of the Department of Obstetrics and Gynae in AIIMS, New Delhi. It's an honor to have you, Dr. Neena. And you're going to talk on challenges to ART in this century. It's one field of gynecology and obstetrics which has gone ahead by leaps and bounds because of the evolution in the technologies. So it's actually a marriage between the subject and the advancements in the technologies. Even I understand that artificial intelligence is going to promote the ART technology, apart from many other things like the genetic screening and the improved embryo selection techniques, even robotic technology and nanobots. So I do hope that the department keeps a pace with these advancing technologies and adopts them in whatever manner they can. We have financial constraints, but in whatever manner they can be adopted so that we are in the forefront of ART technology. I also hope that the department will continue to advance in other fronts also. A proposal has been submitted to the UP government for making an apex center for women's health, which will have, apart from a maternal critical care medicine unit, it will have many other facilities where patients will be referred to as an apex facility. That proposal has been prepared very diligently by the Department of Gynaecology under the leadership of Dr. Anju. We've submitted it to the UP government, and we do hope that it will get approved, and in the land which is behind the Obstetrics and Gynae department, that is the QMH, the building will be constructed and it will become the apex center of the state of Uttar Pradesh for women's health. I congratulate the department and also all the awardees today. I think this was a phenomenal kind of vision by the department to felicitate and award all the meritorious residents and the paramedical staff, because the Foundation Day really belongs to the staff. Each one of you have contributed, each staff here who's present. I congratulate all of you. You have contributed along with the doctors, along with the faculty in the growth and development of the department. Any medical institute is a team effort. Every single person from a class 4 employee upwards contributes in the development of the institution, in the development of the department, and you brought it ahead. One more year, you have contributed and taken it to higher heights. And I do hope that all of you contribute together as a team and take this glorious department, which has a history of 92 years, take it further and further on, because medicine is now digitalized, it's technology driven, it's taken a totally different turn, and we have to keep pace with it. But at the heart of it is still clinical medicine and is the optimal management and humanitarian management of patients, where all of you come in. So my good wishes and blessings to the department, and the administration will support it as much as possible. Thank you. Jai Hind.
Thank you, ma'am, for your kind words and encouragement. Next, I invite our guest of honor of today's function, Dr. Kalyani Das, ma'am, to please kindly come and bless us with your words.
So very good afternoon, ladies and gentlemen. The Dean, Madam VC has just left, Sonia Nityananji. The Dean, Dr. Amita ji. My revered teacher and guru, Professor Kalyani Das, was on the dais, and Anju ji. And all my teachers. I'm truly humbled today to stand before you to read the prestigious Prabha Mehra Oration. And I couldn't get more nostalgic than this. But I pulled out this photograph from my album, and if you look at the date, it reads 15 November 1984. It was 40 years back on the same podium amongst the hall when I entered. This was the day of TG reception. And I was just laughing to myself, is TG reception still held? So this is when I delivered a thanks, a gratitude to my seniors for ragging me and making me what I am. And no, ma'am, aged in years. And today I stand before you all truly to express my gratitude to Almighty to give me 40 years to come here and stand at the same podium. And at the same time, gratitude to my teachers. And if I begin with Professor Kalyani Das, Dr. H.P. Gupta, Dr. Indu Tandon, Dr. Jaiswal, Dr. Uma, Dr. Manju Shukla, who's there. And I do miss Dr. Urmila ji, Anju ji, my seniors. I've taken the liberty of calling them G. And of course, those who I'm missing here, Dr. Sandravati, and those who I'm truly missed, Dr. Sushma Pandey and Dr. Asha Harish. A lot of gratitude to be here. And I would have gratitude for my teachers who gave me to believe in myself to be here again. So I know there's a mixed crowd. A lot of you will not understand a lot of advances in technology. And thanks to Dean Madam, to all those Netflix watchers, you must go back home tonight and see the making of the first IVF baby. It's a must-watch movie. Today, WHO has recognized infertility as a disease, which had not been. And I won't really bog you with numbers, but it is a problem not just of the couple, of the family, of the community and the society. When women were ostracized, and today also, they suffer. Figures may be deficient or a little over, but then today, thanks to assisted reproductive technology, over 11 million babies have been born to many of these childless couples. And annually, the number of cycles that we are doing world over is increasing, and so are the babies. Indicated for women with tubal factor, couples with male factor, endometriosis, PCOS, and those with many, many indications, it's gone beyond the horizons of infertility, including fertility preservation. For those who are not gynecologists, and to those gynecologists who are not practicing IVF infertility, I'll just sort of give you a snapshot of what this procedure is about. It's about helping couples have babies by creating embryos in the lab, not test tubes, but probably dishes. We stimulate her ovaries with hormones, then do the pickup in the OT, take these eggs, hunt them, inseminate them with sperms, create embryos, check them, and put them back in her womb to hope for a pregnancy. And those which are surplus and at times indicated, freeze them for future. I know you all know this beautiful picture of Louis Brown, who was born in 1978. She created flutters in history, the first IVF baby. Yes, remembered are the two who got the Nobel Prize, but forgotten is the lady who was embryologist Jean Purdy, who is reflected in this Netflix movie. She was the backbone of the whole procedure. And of course, Louis Brown is now a mother of two babies. But what we forget is India contributed the first IVF baby 68 days later. An unsung hero who was ridiculed and he was ostracized, who committed suicide because he was called a fraudster. But Durga was born exactly 68 days later. And you'll be surprised that this baby was from a frozen embryo transfer. So there we are as Indians, created the first embryo transfer from a frozen cycle. And today, let's look where we are. So a lot of milestones that I thought I will share you that happened in these years, which helped us realize to create 11 million babies. To remind you that the first IVF baby was from a natural cycle. At that time, Patrick Steptoe did not know he was stimulating, but Louis Brown was born from an unstimulated ovary. He used to pick up the eggs from the laparoscope, which he was mastering. And today, look at the beauty of the hormones we've reached in 2011 to newer of pens, right from biosimilars, gonadotrophins to recombinants. And then we have learned so many protocols that we've mastered the art of creating good number of oocytes. Another landmark in the milestone was male factor until ICSI came, when we could inject a single sperm into an egg and create an embryo for those men who could not father a baby because of azoospermia or severe male factor, and subsequently, surgically retrieve the sperms from the testes and create pregnancies after testicular sperms. Of course, the ICSI procedure is indicated for many reasons, and which are male as well as non-male. And I know today, if you look at the number of ICSI cycles world over, it's increasing. An increase perhaps because of commercial reason or otherwise, but the numbers are alarming. And of course, if we say we are justified, I would just kind of keep adding a little bit of evidence for those who are scientifically oriented, that it increases the cost even for the ones who are justified by almost 8.3% and much more. But truly, it's not shown to have benefits when it's not indicated, and therefore recommendations don't suggest ICSI in all-male vector. Not to forget the culture system, and I can recall in the late 80s and 90s, and also when we started IVF at Queen Mary's, we were making our own homegrown, home recipe media from the double distilled plants, weighing the salts and creating. Thanks to the culture system, thanks to the media, today we have gone beyond the boundaries of struggling to create media. We get tailor-made media. And not to forget, today we have looked up to improving survival with these medias, adding antioxidants. So what a way jump we've had in the last 40 years. Another milestone we achieved was freezing embryos. And today we know that freezing embryos is a way forward when we look at improving live birth rates. Of course, it's gone beyond the boundaries of just freezing embryos. Today we have a so-called social egg freezing, where young women are putting their fertility on hold, trying to sort of look at their careers, paths, and trying to say, yes, we can freeze embryos and then come back later and use them. Not just the women who have cancers and many more indications. So oocyte preservation is on the rise. So let me begin to say what are the challenges. And this was all what I talked was for the 20th century, beginning 1978 until 2000. So moving on to the 21st century, let's look at what are our challenges. Challenges are many. There is a growing demand of IVF. And I was told by a newspaper man that till 5 years back, there were 4 or 5 IVF units in Lucknow. Today, they have swelled up to probably 40 or maybe more, I don't know. So there is a demand, but is there a disparity? Yes, we'll see. What is the changing paradigm in our patient profile? And let's look at technologies. And I think with paucity of time, I'll rather be very quick on the technologies. Are they really helping us improve live births? Are we meeting the expectation of the couples? Because when a couple comes to the IVF, bacha to hona hi hai. That is the thought. Are we making their dreams come true? And what is the challenge of ethics and law? And I'll go one by one. So looking at the increasing demand, we know that if you read the editorials for BMJ right from 2014, we clearly say, are we overusing IVF? Yes, we are, and I will show you how it is. Because the ICMAR data, which is the Society of International Committee on Monitoring ARTs, clearly says that 20% rise in IVF cycles since 2011. And truly it's because of evolving technologies. But is this increase really balanced world over? No. Look at the worldwide IVF availability. In most developed countries where figures go to 3,000 cycles per million inhabitants, in India, we still don't cross 100. So we are increasing, but are we making it accessible? Certainly not. Look at the IBM online data, which comes on affordability. Is it affordable? In this affordability charts, India doesn't figure because we don't have a registry. But you'll be impressed to see that even the most rich societies where IVF is in good numbers, like Belgium and France, are not able to afford beyond 10%. The numbers are more because in these countries, IVF is on the public system. It's free. Let's look at the IVF market. I'm not an economist. I'm not a financial, honko, but I was impressed. The market, which is looking at US from last year till now, will show a rise. And this is the kind of prediction which the financial guru says in 2032 will steep from $25 billion to nearly $60 billion. I had to ask my son, who is a finance expert, on what a CJGR means. And he told me it's a compound annual growth rate, which actually tells what is the return on investments. And this is an industry which promises. So if you look at the global market, it will increase a CAGR of 13.2%. So all those people investing in money and trying to put in shares, it may be too late, you've already missed the bus. An increase in the US of 4.5%, but look at India. a market which is likely to grow by 18%. Wow. And why are we going to increase? It's because we will be increasing the number of IVF cycles that we are currently doing to 2.5 lakh per year to almost 6 lakhs, 3 times. But then if we are increasing, why will we benefit? But then, yes, we will benefit in the number game. It's like selling McDonald's burgers. Look at the IVF cost world over. You know, one IVF cycle in the US costs close to $25,000. In India, it's just 1,200. So we still have a big market. Now, what are the drivers and why we're seeing an increase in the IVF is certainly because there's an increased awareness. We've got IVF technology, a gizmo which comes in the US. In the next month, it's in India. Of course, we have got an infrastructure, and very, very important, we have buying power. Couples have the affordability to spend that money. So let's come on to the next challenge and concern. We are seeing an affordability, we are seeing a rise. But are the patients the same? Not really. I think when we started the IVF unit in AIMS in 2007 to today, I see a drastic change in the patients that we are seeing. Of course, there is increased numbers of diminishing reserves, but also we're getting women and couples come very late. So is it a rising infertility, which is truly infertility, or it's what we are creating? So let's look at the world global fertility figures, which is showing a decline in the last 40 years. And if you look at India, we are following the global trend. To look at the world stats, PFR of India has fallen close to 2%. And I tell you, there are states in the Northeast, including Sikkim, where the TFR is close to Nordic countries, because the Sikkim government comes to us with distress that they're offering incentives to couples to not create 1, 2, 3 babies, but women are not keen. And they're setting up IVF units to take the answer forward. And what is the reason? Because women world over are pushing the age of childbearing. Look at Europe, where we have data. We don't have such brilliant data from the developing countries in India, but in the Southeast Asia, women are delaying, and so in India also. And this is from the rural India, not urban. I'm sure you will be getting women come later. So if you look at the reasons why we are seeing a declining fertility, is it truly declining fertility or a subfertility which we are creating? Our reasons very obvious. Women want to come out of their homes, earn money and earn a living. And therefore, we see that this is probably a iatrogenic infertility. Besides, we are seeing women much more commoner with diminishing reserves. So where is sex for reproduction? We had a barrier of contraception, but today we have the backup. Why depend on sex to create babies when we have IVF as a technology to create babies? That's what is the challenge. So it's like a reproductive switch. You can switch it on, switch it off, and if you really want to have babies, go to the IVF specialist. Again, something very exciting, and I like this kind of analogy that I like. There are Veblan goods, Veblan effects. For those people who have luxury and who have money, they would like to buy costly cars, have luxury branded watches. And the Veblan good says that costlier a good, the more is the demand. Perhaps IVF is also going to be a Veblan good sooner. Thanks to our society, the price we are paying. So is the reserve lower in Indian women? And I think there is data which says yes. Indian ovaries age almost 6 years ahead of Spanish. This was data published way back in Fertility Sterility from a unit of EV, commonly between Spain and India. And there's some other data which we published this year from PLOS, where we looked at the normograms, because we really did not understand what is the normogram for AFC and AMH. I'm sorry, AFC and AMH are markers of ovarian reserve, anti-Mullerian hormone, and the antral follicle counts, which we measure to check how good her potential to create babies. And when we did this modeling, we found that Indian ovaries in terms of AMH did not follow what the Caucasian models told. Also, on the AFC, and what a beautiful data that we got from this data of 4,000 patients that we had taken, both fertile and infertile. We found that the ROCs, which you asked these statisticians, said that there is a decline as by definitions setting in as early as 31 to 34. So for all those young aspiring women who are wanting to defer their fertility, if you want to cryopreserve eggs, don't wait until 36, 37, go early. And for couples who are trying to hold on, create your embryos early and then go on the Veblan goods. Is it for our genes? Because whenever there's wrong, we blame it to the genes. Yeah, my genes are bad. And it's honest. Indian genes are not good. And we find that Indian data matches some of the Chinese and the Southeast Asian, because Indian and Chinese ovaries age faster. But I think it's the environment, what we are breathing, living, eating, and staying. I'm sure you will accept that my great-grandmother was fertile till 44. That's what your patient says, 45, but not today, because she never took so much of pesticide. She was not sitting in ACs. She was not exposed to all the products. And today we see a woman with a diminished ovarian reserve. It's not she who's been taking this. It's a grandmother or the mother who has taken, and that's what is called the effect of endocrine disruptors. And you look around, you are every day in facing, right from plasticizers to the environment, which is so not toxic, so not so friendly, but toxic for the ovaries. So, of course, there is now data from animal models and a lot of studies happening in the US, which are clearly showing that these are going to reduce the reserve, not for women, but for men, and probably be responsible for reduced outcome in IVF or ART, but lo behold, even on the pregnancy, when you see more IUGR and preeclampsia. Let's look at the evolving technologies. We've had a lot of gizmos in the last 20, 21 years. I think we have been flooded by technologies because what we want, not just to increase the success of the IVF cycles, but also to tailor-make babies which are euploid and probably do some selections or what are called tailor-make IVF babies and thereby increase the demand. And in this day and age of the laboratory advances, we've talked of laboratory in terms of the new kind of techniques that we have, but I won't call it artificial intelligence. It's called now augmented intelligence and precision medicine. And let's see where we are. To the age of vitrification, which we've mastered, because this improves not just the oocyte or the embryo outcome, but is really, really useful. And today, most units in the US swear by freezing all, by saying that it increases the pregnancy rates. Maybe it increases, but then it comes at a cost because it's increasing the complications of pregnancy as well. If you look at the rising trends in freeze all in the US, there is a good rise. And so is the market, which is increasing. But is it really going to translate to almost 80 or 90% live births? Certainly not. Let's look at other technology. We've all trusted our embryologists to look at these high-tech, microscopes called the to these good microscopes and look them. But today we have a lot of techniques which tell the embryo is better genetically or not by looks, by behavior. And we have a thing called time-lapse imaging, which is available in my lab also, in the top-rated labs. But is it improving? I think there are recent papers as recent in Lancet, which clearly say that though they may improve your precision in choosing the right embryos, they don't improve the live birth rates. And that is what is coming from this data. So let's look at genetically. We know that if the embryo is created in the lab, it cannot be what nature creates. It will definitely be more aneuploidy. And today, when we talk about having a euploid embryo, we are improving the chance for pregnancy. This is what is called as pre-genetic testing. That is testing an embryo, testing it to be chromosomally normal, and then putting it back so that we can improve the pregnancy chances. And so we have some kind of, gizmos which you're using. Certainly, if there is a family where there is cystic fibrosis, there is thalassemia, there is a balanced translocation in the husband or the couples, it merits what is called as a PGTM or PGTSR. But PGTA means that you are looking at an embryo, declaring it is chromosomally normal, and then putting it back, which is called as testing for aneuploidy. And this is because we know that embryos that are created in the lab have a very high chance of aneuploidy. And also when women are advancing age, look at it, at 34, 35, the chance increases. And I think 60% of our patients are coming to us when they pass 36 years. So what we do is we do a very precise microsurgery on the embryo, pluck out maybe one blastomere from that embryo on a day 3 or few cells when it's a blastocyst, send it to the lab, say yes, it is a euploid cells. Meanwhile, we freeze that embryo and come back 2-3 months later and put it back if it is absolutely normal, hoping that it's going to give you a pregnancy. But let's look at data. Does doing a PGTA to put back the right embryo increases? A lot of meta-analysis, a lot of randomized trials, none saying it improves. And if you today look at a kind of a statement which comes from the American Society, it says it's not going to benefit in improving birth rates. It's just going to help a small group of patients. And we move further in the last 7-10 years. Why disturb that embryo? Why pluck out cells? Why take out and harm and damage? Today, we can use the unspent media that is there in the dish or the so-called test tube and send it for a cell-free DNA analysis. And thanks to the techniques that are available, the newer platforms where you take the culture fluid, which is not being utilized, send it for sample, and then look at what we call as non-invasive PGTA and get the answer. But is it confirming to an improved live birth? Certainly not, because this technique is again got its challenges. We don't have concordance, and of course it's costly. So let's look at artificial intelligence or augmented intelligence, which is really, I think, two fields in medicine where, it has come out as a big kind of game changer is radiology and time-lapse. And what is time-lapse? It's a CCT camera sitting in an incubator capturing images. And therefore, in the last decade, they have made newer algorithms, which newer scientists, or I would say IT people from Stanford, the Silicon Valley have got on with brilliant minds in embryology to say that they can create good quality embryos can be predicted. Certainly not. We are waiting. Precision medicine, will it predict? A lot of data sets. This is the age of data. Data scientists are flourishing. But till now, we don't have the answer that at this data set, we will have predictive models because we are still struggling to find answers. I won't talk much on fertility preservation in terms because we know it is the technology for cancer where we can give women with cancer a hope. But look, are we sort of offering something brilliant to those who are deferring their fertility by oocyte cryopreservation is not known? Because these are some indications. I would certainly say yes, your ovaries are going to be damaged. Go ahead and cryopreserve your eggs or embryos. But social, we really are not very sure because we have data on the live births of embryos, but we don't have data of live births from oocytes which have frozen till date. And these are all the techniques that are being coming up from oocyte cryopreservation, depending on when the woman comes to us as an emergency, as a cancer patient, whether she's single, whether she's going to have a chemo or radiotherapy. Again, another milestone was ovarian tissue cryopreservation. A child being born today, 163 children have been born from this technique called OTC, which is available at AIMS, and I lead that facility where we are helping cancer women. But I hear that Norway and Denmark, women have started freezing their oocytes, their ovarian cortical tissues, because if they get menopause, they'll put this OTC and sort of stay young forever, because this is an ovarian tissue they're going to cryopreserve when they are young. So look at where science is moving. And if you look at the worldwide data, very few centers are providing, and I'm very proud to say that out of the 3 units in this map, AIMS is one of them, which is providing OTC facility besides other oncofertility. Let us look at the next challenge, expectations. And I always would sort of get upset, but I just laugh now. When the patient comes to me in the OPD, Dr. Saab, उन सेंटर ने तो 80% नहीं 90% IVF में सक्सेस बताया, आप इतना कम बताएंगी. Today I smile because I think I should get these printouts and show data, which is coming from the country which has produced the first IVF baby, data from the Human Embryology Fertility Authority, where despite the advantages, you can see that even in the young woman, pregnancy rates after a transfer are not crossing 40%. And of course, the biggest registry of the world, the SART, coming from US, their latest data in 2022, because 23 will come in 25, all clinics, look at the number of clinics, the patients they are doing, enormous, non-donor oocytes that they're retrieving. And if you look at them, fresh embryo transfers, mind you, this is without doing a PGTA, not looking at the aneuploidies, their live birth rates are no more than 40%. So where are we? Who's this unit who gives 80, 90, where technology is far ahead of us? They're so more advanced. And every IVF cycle, you have to sign a consent when you give $25,000 that every embryo will undergo a PGTA, even if you want or you don't want, you're indicated, you're not indicated, or an NIPGT, and all embryos will be frozen. So let's look at this number. And then let's look at the frozen embryo which are undergoing a PGTA, that means euploidy. And this comes with a disclaimer. 59%. So if you feel very happy, oh my God, 59 means it's phenomenal. But then you don't read the bottom line of the table. It says that this is data coming from all the embryos transferred. Almost 20 to 30% embryos will be discarded because they're not euploid, or they're damaged because doing a biopsy damages, and of course the mosaics. So don't get carried away. You have to take and understand. So are we honest or dishonest when we tell them numbers of 50, 60, 80, 90. I think we have to understand. Let's look at then what are the opportunities. Fertility preservation for social egg freezing. Surrogacy, as many celebrity couples do it in India. They don't want to have their babies. And today, when surrogacy law or the bill or the law has been passed, I'll tell you, most elite couples are flying to US to spend 2 crores and get their surrogacy done in US. So money is draining not from here, but to West worlds. And that's the story. Are we giving them options to choose a healthy baby? Are we giving them opportunities for just to use new technologies without an assurance of increasing live birth? Or are we going the Veblan goods? Just use IVF to make babies. And this is what happened. India was the hub of gamete donation, surrogacy, commercialization, exploitation. And that's why we ourselves, I should say, are victims of our own success stories. We gave reasons to all those NGOs to go and present in the parliament. And here we are, another challenge for us. And the challenges of the ART bill, ART law. Are we not suffering? Not we, our patients. Because a woman who generally can get a surrogacy can't afford it. Who will give her an altruistic womb? Not really. So really, I think we should take all this to understand what are the pitfalls of the third-party reproduction, and very beautifully to realize that while we are harping to say we are going to have a CAGR and all those cycles increasing, can we deny we still don't have a registry? Well, in countries like Africa, there is a registry called ANARA. Shameful that India still doesn't have an ART registry. And I looked up to see what IVF registries worldwide are. This was a beautiful editorial in the RBM Online, and it really tells and reflects the challenges that we will face in countries like India, where we feel it's a threat to our privacy, where we are actually giving data or not. And that's the reason why we are not still happening, or maybe for better reasons. So I would end here with just one slide. I've talked a lot about challenges, just one slide for solutions. And I think I'm not a politician, I'm not a policy maker, but there are solutions. We need to expand. And it's not just creating IVF units in public funded hospital or state medical colleges. It is sustaining. It's about sustainability. Are we able to let them go further with the kind of requirements they have, the procurement of media, equipments, consumables? And of course, the time has come, because in the last 3 months, the import duty on all media coming from Europe and Australia has ebbed up by 28%. Are we not to look back and say Make in India? And I'm happy to share, there are companies which are coming up with Make in India, thanks to the CCMB Hyderabad, where scientists are making, and we have to accept that this is the way forward, otherwise we'll not be able to survive. We need skilled human resource. We have plenty of clinicians, plenty of doctors, but what we really need is a good pool of embryologists, technologists. And the worst is in public funded hospital like ours, where people are poached and they go off for greener pastures. Can we retain them? That's what is the solution. We need to train and do regular audits, which is very important. Otherwise, we'll be basking with 80-90% of the ART outcomes. And I don't have to tell people what is ethics. I think ethics is what we have, me and you have to define, and have to tell the juniors and our younger generation what is ethical practice. And very honestly, to give realistic outcomes, and above all, let's fight out for the ART registry. So I will just thank here to give you a snapshot of our IVF unit, which we really recently moved. And this is the view of our ART lab. And I would really acknowledge and gratitude of this being supported by the Infosys Foundation. So if government doesn't, we have some CSR funds to look up to. Thank you very much for your patient hearing.
Thank you very much, ma'am. Your command on the subject was very awe-inspiring for all juniors. May I please invite Professor Amita Pandey to come and give the vote of thanks.
So good afternoon. And as we come to the end of the Foundation Day celebration, I am honored to stand before you to express my gratitude on behalf of the Department of Obstetrics and Gynaecology. So even though our Vice Chancellor and our respected Dean had to go away because of some urgent work, I would like to extend my heartfelt thanks to our Honorable Vice Chancellor for gracing this occasion with her esteemed presence and giving us her blessings. And I would also like to express my gratitude to our respected Dean, Professor Amita Jain, for her unwavering support and her leadership. A very special thank you to our guest speaker for the coveted Foundation Day oration, Dr. Neena Malhotra ma'am. We are indeed grateful that you could take out time from your busy schedule to be with us on this special day and enlighten us with your mesmerizing talk. It was indeed mesmerizing. We were just awestruck. My respect and regards to the guest of honor for today, our very respected and dear Kalyani Das ma'am, for taking pains to be with us today. A heartfelt gratitude to all other seniors, teachers, and guests for being a part of today's celebration. Your presence has made this event truly memorable, and we are so grateful for all your support. Thank you to our faculty members and the nursing staff whose commitment to teaching, research, and patient care continues to set the standard for excellence. You have proved that whenever the art of medicine is loved, there is also a love for humanity. And thank you to our students, all those who are here. You are the future of this great field. As we all know, education is the most powerful weapon which you can use to change this world. We are indeed proud to witness your growth, and we look forward to seeing you transition into the next generation of leaders in obstetrics and gynecology. I would also like to express our gratitude to all the support staff who work tirelessly behind the scenes to ensure the smooth functioning of the department. Your hard work is invaluable, and as we often say, behind every successful doctor is a great, great team. My gratitude also to the people from the press who are here to support us. And lastly, as we conclude today's celebrations, let us remember that the good physician treats the disease, but the great physician treats the patient who has the disease. Let this guiding principle shape the foundation of our department and drive us forward every day. Thank you all once again for making this Foundation Day a grand success.
Thank you all respected, esteemed guests and faculty who have joined us on 92nd Foundation Day of our department. It was truly a day to rejoice and to look forward for the future. Thank you.